Fly, what a long. We need the Twin Peaks ambiance. So today we are going to focus on this. So, what is the single most important thing to take into account when correcting for hyponatremia? Let's bring out it's how long the patient has had hyponatremia, and that is because if they've had it, if they have had it a short period of time, the cells have not yet. What's the word for it? I don't know the time span, but I'd say like below, let's say 24 hours, the cells have not yet compensated for the hyponatremia. And how the cells compensate for hyponatremia is because hyponatremia decreases the osmolality of the blood, making it so fluid more easily escapes to the extracellular or intracellularly. And so for the cells to prevent themselves from absorbing a bunch of blood, water, fluids from the blood, it excretes a lot of high osmolality particles like proteins and enzymes. Well, I guess proteins and salts. They excrete it into the bloodstream to protect themselves. Now, if you were to compensate for hyponatremia for someone who's had it for a long time with cell compensation, you would have a risk of drawing too much fluid and dehydrating the cells. So that's why how long the patient has had it is the correct answer. So chronic hyponatremia above 48 hours. Yeah, so too fast compensation leads to osmotic demyelinization. Yeah. Next question. The most common cause of reoperation of hip prothesis, that's prothesis. Orthopedic prosthesis. Prosthesis. What? Prosthesis. 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 Yeah. Hip prosthesis.
Prosthesis.
Prosthesis. Okay, prosthesis. Oh. Most common cause. Okay, let's think about this. Deep infection. But this is long term. It's not repeated luxations. It's not discomfort with function. So, aseptic loosening. Maybe we should actually have a corresponding one up. Oh, and also start the timer. We duplicate this. Bring up one. How do we put this? I guess like this. Okay, so there it is. Alright, so I was leaning against this. Oh, yes, yes, of course. So with aseptic larceny, you get like aseptic particles because of grinding between the implemented prosthesis. That triggers macrophages and then osteoclasts, and then bone gets broken down. Yeah. Um, yeah. Epiphysiolys, caput femoris, that is cause. That's svarta knall och inte höft. It's referred pain via, yes, Artorius. Referred pain. And epiphysiolysis caput femoris affects children in the puberty. It's exacerbated by obesity. And it is treated with in situ fixation with screws. Vastasfälla, symptom med låg knä utan höftsmärta, alltid röntgen. Överviktiga pojkar, puberteter med låg... Ja, nice. 2 for 3. Dislocerad kolonfemorisfraktur hos LU-patient. Halvprotes has to be. Associerad avbruten femur i huvudet, blodförsörjning just av AVN risk, avascular necrosis. Half prothesis eliminates the risk. Yep. Other cancer Gleaser 9. That's very high. Treatment. Well, I mean, this depends though, if it's spread or not. You can have a curative. It's probably this, but this is entirely dependent on if it's spread or not. Right, yeah, Gleason 9, very high risk, localized disease plus healthy patient. Yeah. Yeah, you can't, of course, you can't wait if it's like above an 8, because they will die. Escherichia paradoxa, that's filled bladder. Blåsningsöverdissociera tryck överstiger sfinktermotståndet passivt. Yep. Antibiotic treatment. DPI. I think it's a triple treatment. Yeah, triple treatment, amoxicillin. This is in the latest one. Pancreas. Pancreatitis. This is celiac. Hernias. Oh yeah, here it is. Treatment. Hypotherapy. Ingen beteende för sånt, just det. PPI, amoxicillin, claritrum, amoxicillin, claritrum. Parkinson, kardinalsymptom. Parkinson, that's at the end of here. Here's park. Right, so it's Brito. Yeah, that makes sense. Ge mig elektricitet. Måste då... Oh. Don't know this one. Hmm. We should have a picture for this. What's up, Subaru? Oh yeah. Want a picture of this. All right, let's walk through it. Succinylcholine is a depolarizing muscle relaxer, which causes well, it causes hyperkalemia. What the fuck is calling me? Sodium? No. Potassium. Potassium. They bind nicotinergic acetylcholine receptors on muscle and plates, activates them, causes depolarization. During depolarization, sodium flows in, potassium flows out, like in normal depolarization, but it's prolonged. So you get extra potassium in the blood, so you get hyperkalemia. Alright. Prolonged depolarization. Leaks from muscle cells from myocytes. Serum potassium rises. Don't give it in, yeah. Right. Ortons, akut behandling. Oh. I think verapamil is long time treatment. Yeah, I think it's this. Sumatriptan. Effect, mycket god effekt. Verapamil prophylax. Oh yeah, okay, so verapamil is prophylax. Why does it do that? Huh? Yeah, okay. Yeah, that makes sense. Come on. You can do it. Sumatriptan, förstahandsvadlig hårtans, profylax verapamil. Syrgas har god effekt. And it acts on serotonin receptor to cause vasoconstriction. Primary sclerosing cholangitis. What it is. Uteseende galgångssjukdomar ser över IBD. No. No. It's a chronic fibrosis, yeah, highly associated with IBD. It's especially associated with ulcerous colitis, I'm pretty sure. Yeah. Yes, we got it right. It's primarily associated with ulcerous colitis. Oh. Did you guys see that? Oh, you're just... Cutest kitty there is. Is he gonna say that it's 75 patients with the PSC has IBD and especially ulcerous colitis. Caliber fluctuation, an MRCP. Lungcanceron 15%. Yep. Yeah. So like 5% of patients with ulcerous colitis have PSC, but 75% of patients with PSC has ulcerative colitis. That's the good distinction. Pig looks. That's a very common occurrence for children. It's a dislocation of the radial, the head of the radial. You start with it's this. You have them in the 90 degree like this. Then you do that or go back, right? It's this. Inclepted radiohumeral. Yes. It's the head of radialis. And its ligamentum anularis is hinged behind them, and then you try to flick it back. Typical symptom or clinical presentation is that the child is holding their hand in 90 degrees close to their body, and they don't want to move their hand. I think I have a good illustration of it. There we go. So you start. Right, they start in a pronating position, and then you. When they say flexion, what do they mean? Okay. They hold the arm in 90 degrees. Supine the underarm, so it's in a pronating state first. No, it's pour the soup. Supine. Hyperpronate it back. Right, so you supine it and then you yeah. Pour the soup, hold the soup. Pour the soup, hold the soup. Pronation. So he would start like this and you would supinate it, or then you would pronate it back. Yes. Okay, good. Diabetes, ketoacidosis, young type 1 diabetes with pump stop. I mean, go to the processes right there. Undislocated scaphoidean fracture in the mid. I would say you screw it to prevent avascular necrosis. Do you do... I'm gonna go with... that was wrong. Dislocated or proximal. Okay, so it's only proximal fractures. If it's in the midsection of the scaphoideum, it's fine. Proximal fracture, yes. Because it has retrograde blood transfusion. Or blood fusion, whatever. If it's undislocated, it's in the midsection, or it's distal, it's fine. But then you want the tomb yips. That's a finger fracture. Fossa tabataria. Tabatiere. Anatomiska snusgropen. Håll handen. Go back to that picture. Ulnardevierad. 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 Fossa tabatiere, samtidig ulnardeviation. Känna hur scaphoideum smidigt kommer fram. Möter din palpebral. Ja. Right here. Över scaphoideums distala pool. Här. Så. 3 tests. Alright, treatment. Skaffa DMG som är FCP-ledfri. Right. Så här. Skaffa DMGips. Okay. Okay. Konservativ. Ja, artikulär så IMSU inkluderas. Annars, right. Jag för DMGips MCP-ledfri. Ja. Terminalbok. Varför högst? This. Muskbandet. Knatligament. Ja. Långport. Klämmer. Upp. Betesnäffel. It's this. So mineralkortikoid, SGL2 plus AC, MR, ARB. AC aldrig kombineras, det är samma sak. Finner en någon. So not NSMRA, yeah, non-sterile, non-sterile luminocorticoid. Yep. Missed high sensitivity for ACL. It's Lachmans. Yep. Lachmans is you grab the legs. So here's the thigh. Here's the your chin. I guess your chin, like your under leg, and you hold it like this, and you. So at like a 30-degree angle, and you pull it like this. 20 to 30 degree, pull it up, and if it gets looser up in this direction anteriorly, you have an ACL. Yeah, interior sliding 20 to 30 flexion, ACL maximal position. More sensitive than anterior dryer test. Anterior dryer test is you have the leg in a 90 degrees and you put your foot, you put weight on their foot and then you pull it. Same principle, but this is more direct. Most common debut symptom of Parkinson. This. All right. Tremor. 70%. Yeah, 3 to 5. Stillande. ATAV-reaktion. Yep. Central or peripheral? Oh, okay. Okay, central genesis. Head impulse test and blick fixated nystagmus. That's peripheral. That means your cochlea is damaged. So if someone has a damage to their balance organ, so their cochlea or vestibular system, cochlea vestibular system, your eyes will hit towards the hurt side to start, and then if it's completely destroyed, it will you have what's called well, that's destration nystagmus. It will so nystagmus is your eyes like going side to side. Destration nystagmus is it pulls to the healthy side because the other side is completely damaged. But before that you have retning, so I guess I don't know, annoyance, whatever, so it hits towards the hurt side. But that's peripheral. So central genesis, you want it should hit to both sides, and head impulse test should be normal. Head impulse test is if you hold the head like this and then you flick it back quickly. If the eyesight then flickers and then goes normal, that means you have a positive head impulse test, and that means that something in your balance organs is not correct. Vestibular ocular reflex is damaged. So riktningsfixerad nystagmus. Ooh. I think it's this. Yeah. Riktningsfixerad plus patologiskt. Yeah, because told me you want alpha, beta, and then fluid expansion. So alpha for 10 to 14 days, and then beta, and then, because if you don't do that, once you remove the pheochromocytome, which is a tumor in your, well, yeah, adrenal glands, right? Binuda. Yeah. Yes. So in the cortex of the adrenal glands, catecholamines like norepinephrine and epinephrine are produced, and and it secretes it. You have to block that properly before you remove it. Alpha always before beta. Beta without alpha, opposed to alpha effect, paradoxical hypertensive crisis. Deposed. Oh, what the fuck was this? Oh, that's this. And it's highly hereditary. And it's more common in men. Oh, which is wrong. Well, this sounds wrong. It's nothing to do with cold though. How long am I streaming today? Well, I want to complete this. I have 89 questions I want to go through. If I go beyond that, I don't know. But then afterwards, I'm gonna stream WoW. There's so much new stuff now in Phase 3. This is not relevant. This is correct. This is very common in men. This is what's called a Viking's disease, or like a Viking something. It's highly hereditary, and it causes, I guess, contractions of the. Causes contractions of the. It's not the joints. What do you call it? See, like tendons. Yeah, the tendons in your arm gets thicker and more contracted, so your fingers get drawn in like this. It's very common for like Scandinavian people. Not common, but it's very strictly linked to it. But adduction contraction is not relevant. That's for if you have abduction or adduction contractures is relevant to arthritis in the thumb. I feel like the AI has done something wrong here. Where did I write about this? Really? Okay. Well, okay, I think it's just this. Alright, so I was right. This... But this isn't correct either. Both of these are wrong. They have nothing to do with it. So the fucking AI has made a bad question. This is not relevant to this disease. This movement in this axis is not addition or... Well, is it? No, because this is flexion. Movement like this, I don't know. Like, it's just wrong. Oh, your dad has that? That's interesting. Well, so does he have the Poitrin's contracture or does he have trigger finger? Because they're very similar. Like you can either have inflammation in your, like you could have bursitis, so you have like little bursts here, or like at the bottom of your fingers you can get like localized inflammation, which is called trigger finger. So like the little nodule tendons here, you get inflammation in them. I actually have done cortisol injection of that when I've been working at like primary care. That's different. Here you're getting like sclerosis all over your tendon and your fascia. Yeah, so it's flexion contraction. It's not adduction abduction. Yeah, so the fascia gets thickened. Whatever. And you can either treat it with like opening up and completely removing it, so needle fasciectomy, or open fasciectomy, or partial fasciectomy, or you can inject Cyfex that like loosens up the collagen. Moving on. Alright, MS diagnosis, multiple sclerosis. So multiple sclerosis is a clinical disease. You don't diagnose it through MR, though you can, because you have demyelization, but it's primarily dissemination in time and room. So someone comes to the clinic and says that they have, like a couple of months ago, they felt weakness in the legs bilaterally, or I think maybe ipsilaterally as well, or unilaterally, and then maybe they have like decreased seeing and color vision on one eye. So that's two typical symptoms for multiple sclerosis, and it's disseminated in time and room. So where the symptoms are, and also when the symptoms happen. His finger was permanently in that position before surgery. That's interesting. Does your father have Scandinavian heritage? Here, Northern European heritage is very common for the poiners. Dupuytrens. Excuse me?
We are looking at how to pronounce this name, of French origin. For reference in French, it is said as Dupuytren.
Dupuytren.
Dupuy. In English, however, it is normally said as Dupuytren. Dupuytren's contracture. Dupuytren's disease, it is said as Dupuytren.
Dupuytren. Oh, I will never forget. Dupuytren contraction. Dupuytren. Dupuytren contraction. Dupuytren. Dupuytren. Alright, it's this. So at least 2 separated episodes in time with at least 2 different localizations. So maybe unilateral eye, or weakness in the legs or arms, for example. Let's actually pull up MS, because that is a upper motor neuron. If it affects upper motor neurons, so you would have increased reflexes, and Babinski's would be positive, for example. Let's just search for dissemination. How fluent are you in other languages? I'm just fluent in 2 languages, Swedish and English. I'm decent in German though, but not even close to fluent. Dupuytren. Upper motor neuron, Babinskis stereoreflexer, sensorisk motorisk påverkans. Ja. Most common amongst women. Subacute, yes. Ja, myelin i CNS. Cervical ryggmärg, höger arm. Symptom, ja. This is typical, like, right arm, left leg. Dissemination in room. What's the typical patient here? Alright. 34-year-old. She visits primary care because she has decreased power in her right arm. Takes yeah, whatever. No headaches. All right. Yeah, increased reflexes and Babinski. So this is most typical like of MS. He probably does. My state had a huge influx of German and Italian migrants back in 1800s. That's interesting. Yeah, so maybe if you look back, maybe there's some Northern European heritage there. SGLT, SGL2 inhibitors have nephroprotective mechanism. That's true. They have it through, yes, tubuoglomerular feedback. Yeah. Let's have a look at. So, what SGLT2 inhibitors does is tubular, well, this isn't really the best one. Is there, well, we just do SGLT2 mode of action. But it's a juxtaglomerular that notices an increased amount of sodium. It tricks the juxtaglomerular feedback mechanism that there's hyper filtration going on, so it constricts the afferent arteriolar. My God, my English. Here, do this. Okay, let's follow this. SGLT2. Okay, so this is, yep. Loop of Henle, distal tube. Yeah, here, macula densa. It decreases so it inhibits reabsorption of glucose, so you have increased glucosuria. You piss out more sugar, pretty much. But it also retains, or it keeps sodium in the tubular system. And then the macula densa notices that there's an increased amount of sodium. So it constricts the afferent arterioli, which decreases the tubular. It decreases the EGFR. No, it decreases the GFR. It decreases the filtration rate in your kidneys, which is nephroprotective. Yeah, so you have hyperfiltration in the diabetes. If you constrict the afferent, the arterial. So if you constrict the inflow, you can. So imagine you have two. I'm just explaining this for myself, by the way. So you have a wide. What would you call it? A wide tube. The tube is wide, so a lot of fluid can flow through it, and a lot of fluid has to get filtered through your glomeruli. I.e., you have hyperfiltration. All of this high-flowing fluid is causing damage to your kidneys because of the high flow rate. Imagine just like water flowing through a tube at a high pace. So to prevent the high filtration, hyperfiltration, you constrict the inflowing tube. So there's less flow because the tube is constricted. It's narrower. And that is achieved through this drug, which tricks the macula densa to constrict the afferent arterioli. Or oh my, I can't say this. Arterial. They still speak German in the mountain village here? Where do you live, Subaru? So more sodium gets to macula densa, afferent constriction, decreased intraglomerarular pressure, decreased hyperfiltration, nephroprotective. Yes. Oh, you live in Brazil. That's interesting. Oh, did Brazil do the whole, like, Argentina thing where they tried to, like, whitewash? They tried to, like, import a bunch of Europeans to make them seem more like European, and then, like, try to push out, like, native people and black people. Okay, fludrocortison, inte second. Oh yeah, they did. What's the deal with, like, South America trying to become, like, European, or, like, to be perceived as European? Fludrocortison, inte secondary binary. Okay, wait. Let's think about this. Secondary adrenal insufficiency is caused. It's caused by decreased release of ACTH from the hypothalamus, which means there's no dysfunction in the adrenal glands. Right. And so zona glomerulosa produces aldosterone, and then, so you have EFR, oh yeah, and the reticularis is testosterone. Aldosterone is stimulated by ROS, and ACTH stimulates fasciculata. So aldosterone is kept in secondary binary or adrenal gland insufficiency. So it's this one. Yep. Mac 10, oh, that means like 50%. It's this. Ja, så Mac 1 is ED50, så det var 51%, för 95 täckning. Okej, ja. Epidemidit hos män under, it's chlamydia. No, that's above 35? Oh, above 35, not chlamydia, it's E. coli. BPH, yeah. Retrograde spreading of gut bacteria. Younger, it's STIs. Important preoperative, it's fixing their electrolytes and fluids. Antibiotics is not necessary, obviously not laxating, and cortisone, obviously not. Ileus. Yep. Fluid loss to the third room, meaning your gut. a bunch of fluid is not being absorbed by the body because it's retained in your GI tract due to an obstruction. It causes hypovolemia, hypokalemia, and obviously laxating is contraindicated. The most common cause of death in ALS is breathing failure. Your musculature in your your breathing musculature gets denigrated and you suffocate. Non-invasive ventilation is the most life-prolonging procedure. Deinnervation of your diaphragm and breathing musculature. It's because we lack identity, kind of like Russia, but in the tropics. Yeah, I guess like ultimately South America is like colonized or you know, the result of imperialism. But I feel like, isn't there like a rich South American culture? I mean, you would have to say that it has a lot to do with like North American intervention as well. Maybe, I don't know how it is in Brazil, but how many places in South America has been in like just some like the CIA in North America has fucked with them. I don't know, man. I shouldn't speak on it. I'm not too well read on it. Subarachnoid avblödning, vad letar man efter LP? Santochromy, bilirubin. Because subarachnoid bleeding, you have blood in your cerebral spinal fluid that gets broken down into bilirubin. It discolors it decolors the cerebrospinal fluids, and it stays for longer. So it's this. So yeah, it stays above 12 hours, and it stays 2 to 3 weeks, and it separates subarachnoid bleeding from traumatic puncture. Klassiskt primärbilinjerbacks. Right, so you would have, before we look, you would have low aldosterone, of course. You would have high ACTH. You would have low cortisol. I guess you would have low testosterone as well. But that's maybe, yeah. So low cortisol, low aldosterone, high ACTH. Low cortisol, no. Low cortisol, high, yeah, and high renin, because it's trying to compensate. It's this, yeah. The whole adrenal gland is destroyed. ACTH increases to compensate, but because there's no negative feedback. Aldosterone is missing. Renin released from the kidneys tries to compensate, but there's nothing to compensate, and that separates it from secondary, where you would have low ACTH, high. You would have, so in a secondary you would have high aldosterone, because zona glomeruli, the first zone or the outer zone of the adrenal gland is intact, and that responds to the RAAS system, responds to renin from the kidneys. So you would have normal aldosterone, you would have low cortisol, high, low ACTH. Yeah. Colorectal cancer, alarm symptom, rectal bleeding, yes, this one. Episodic diarrhea and young, definitely not. Flatulence, and this could be IBS or ileus. Perianal rashes. Could be whatever that is called. I don't know, condylome. The fuck's that called? Ah. Hemorrhoids. It's this. But the motivation to get migrants wasn't race. They got a huge amount of Asian migrants in the time too. They needed people with knowledge in agriculture. Yeah, that makes sense. That makes sense. Like, importing skilled labor, obviously, is beneficial. But today the South feeds the world. It's very true. I remember so in high school, I made like a pretty ambitious thesis about Swedish agriculture and to some extent, like Europe as well. A little bit about the European Union. And like the subsidies in the European Union where because the European Union wants to ensure like fair prices to the agriculture or farmers, they buy up excess production. So if a year, you know, there's too much grain or whatever, I think the primary thing was like maybe like cheese, what was called dairy products. I might be wrong on this, but I think that like the primary export of the European Union is dairy products, and they sold it like dirt cheap to like South America and North America, and conversely, European Union bought like shitloads of soybean from South America because they were selling it dirt cheap. So instead of like, I don't know, trying to get like that production up in, yeah, it was just like a bad, dumb system where Europe was shipping over dairy products across the Atlantic and buying soybean across the Atlantic instead of like promoting soybean production in the European Union. Gold standard, plasma, yeah, metanephrine. Oh, that's that thing, but it's this. %97 sensitivity. What was this? System. Oh yeah, that's parathyroid. This is for parathyroid. And this obviously is not related. How come lactose intolerance doesn't seem as prevalent in Europe compared to West? Probably because we've lived on dairy products culturally for hundreds of years. Yeah, probably because historically we heavily relied on like cheese and milk. In other parts of the world they didn't. And that would maybe also be due to maybe because like having livestock was easier in Europe than other parts of the world. Or just, you know, happenstance. There were large herds of livestock that could be domesticated. I don't know, but it seems like something, yeah, just like exposure Probably. You can ask. Due to genetic traits called lactase persistence driven by natural selection, historical famines, disease pressure, over 5,000 to 10,000 years. Survival advantages. In northern regions with no sunlight, milk provided a vital source of calorie and fats, vitamin D when crops failed. Historical spread. Agricultural data shows that while prehistoric Europeans drank milk early on, the genetic ability to digest it surged rapidly during times of severe famine and pathogen stress. Prevalence is highest in northern and northwestern Europe and drops lower in southern Europe. So it's like, it was, yeah, natural selection. The Europeans had to drink milk, and if you couldn't digest it, you died, and the people who could survived. Yeah, that seems logical. Oh, XLRs, right? C5, C6, close to the humeral. I think it goes like this. Delta Deus Paresis. Yeah. I think this is like the battle patch. If it flattens here, and then they have decreased sensation. Yeah. Oh. Stroke in the back circulation symptoms is not typical. It's dysarthria. So in the back circulation, if you get a stroke in any of the arteries that provides the back of the brain, you'll have ataxia. That's very typical because it invades the cerebellum, your small brain, which is primary function is to coordinate movements. Dysphasia, that is... Dysphasia, isn't that just like discoordination of your face muscles? Wait. Oh, dysphasia is the one. What is dysarthria? Oh. Oh, okay. So dysarthria is like it's hard to speak. So it's like motor dysfunction of speech. Dysphasia is decreased understanding of speech. And if you get a stroke in the frontal or parietal, like in the front of your brain or your front circulation, the cortex is affected, and the cortex is what handles higher functions like speech, like understanding speech, not like articulating speech, but understanding speech. So like producing coherent speech and understanding speech. So that's like the BRCA and yeah, so you have receptive or expressive. Raw. So it's this one. Yeah, MCA. Diplopi, dysarthrie, dysphagie, dizziness, proportionate ataxia. Proportionate. Trigeminus, klassisk mechanism. It's the blood flow. Yeah. Fuck, I hate flies. I hate seeing flies. Cerebellis, yeah, so SCA presses on the trigeminal nerve. What's this? Kardiomelering, topiska impulser, elektrisk hugg, smärtlösning där. Yeah, trigger zones if you touch. Yep. Common extrarenal manifestations of oh no, what is this? Dominant polycystisk njurssjukdom. I feel like it's liver cyst. Snälla. And you're dead. Yeah, liver cyst. Boom! Boom! Liver cysts. 80% polycystin uttrycks i koliocyter. Angiocyt. Aneurysm, just that one. So, okay, intracranial aneurysms and liver cysts. Autosomal dominant polycystisk njursjukdom. Njursten, när är nefrostomin indicerad? Vid förhöjt kreatinin, njurpåverkan, bilateral obstruktion, infekterad obstruktion eller solitär njure. This, obviously. I den nefrosår så stenlokalisation, förväntade fynd motiverar inte alltid nefrostomi. Opticus neuritit. Som inte kan sudda syn, nedsatt färgseende, monokulärt. Yes. Smärta vid ögon säger ej, just det, rörelse, inte vila, uttavsfenomen. What's that? Hey. Okay. This is fine. 20 to 30 is fine. Okay, accept it. Okay, so 25 to 30 is accepted. And that is, yeah, because of sancticular pressure. Just the hypocotomy. Yeah, so, yeah. Yep. Lågt till fint. Höggradig, lågt till fint. Just differentiering. Hur lik normalt. Kronisk njursjukdom globalt. Diabetes. Vanligaste just glomerulonefriten. Just det, okej. Vanligaste most common glomerulonephritis. The total chronic kidney disease is diabetes and hypertension. Yeah. Klassiskt triad förekommer symptom. This one. Headaches. Yeah. Okay, hypertension. Yep. Opposerad alfa paradoxal repetition. Thomson test negativt. Barnårsvikt tunntarms ileos hos vuxna. Adrenser. Kolonilis och kanske kolorektal cancer. Ja. Kontrollerad PDE. Nitroglycerin. Additiv vasdilatation, livshotande hypotension. Japp. Och skiljer Crohns sjukdom från Crohns kan påverka. Crohns can affect the whole body. Transmural miscapulations och kan ge fistlar. This is the one. Kontinuerlig mukosa. Ja, just det. Kontinuerlig mukosa allt direkt under växer uppåt. Yes. Transmural miscapulation fistlar kan drabba hela grejen. Japp. Källskada. Kirurgisk ligamentrekonstruktion. Benreduktion. Möjliggör spontanmärkning. Benreduktion. Ja. Now that you made me think about that country's history, it's kind of grim. Wait, what country's history? Yours? The world is indeed a PvP server? Man, you're dooming, man. Yes, imperialism was probably inevitable, but it caused a lot of issues. I mean, there's so many things that are terrible, but that had also like brought positive things. But yeah, like imperialism is bad. I don't think you can argue with that. It was just very, very cruel. But it's undoubtedly contributed to the world that we live in today and all the innovation and shit that we've come up with. The fact that I can sit here with an AI and become a doctor or whatever. But obviously incredibly awful and cruel. Vilket är definitivt för mekanisk ilium. Yeah, caliber differences, gasvätskenivåer. Gas, just det, perforation. Just det. Det är som är dit hamnknas. Ooh. This is a cool trick. Let's see here. If you want to learn, whenever I try to remember rotatikuffen. Okay, you have supraspinatus, infraspinatus. No. It's like this. Subscapularis, infraspinatus, teres minor. So supraspinatus does abduction. Infraspinatus, teres minor does utåtrotation. Och subscapularis does inner rotation. So, I mean, it's supraspinatus. So, infraspinatus, teres minor, out rotation, subscapularis, inner rotation, subscapularis, scapularis, infra, teres minor, yeah. You see it? This is subscapularis, infraspinatus, teres minor. This is the other one. These are the three muscles that are situated like this on your shoulder. So this contracts, this goes up, this is my arm. The one muscle that goes like this, subscapularis. What the fuck is that called? Yeah, whatever. It turns the thing inwards. These two on the other side turn it outwards. Dum, dum. Big smart. Subscapularis, infraspinatus, teres minor. No, supraspinatus, subscapularis. Inåtrotation. Grundbehandling metastaser prostatacancer, ADT. Migränprofylax. I feel like it's this. Ja men typ Delin och typ så andra hand, okej. Okay. Ooh, vilket Babinskis. That's central. Oh, but they're not. You motherfucker. Where are you? I feel like it's this, man. Because it's like, it's considered a lower motor neuron below cauda equina. Or I feel like it's this. No! What? Okay. Yeah, so I was right. Yeah, cauda equina is peripheral nerves, those lower motor neuron. Slappa pareser. Sänkt reflexer, negativa vinski. Positiva vinski hör till... Ja. Hell yeah, we got it. Solus Epilepticus 20, so you've already given benzos whatever. Levetiracetam. It's this. Levetiracetam. Valproat efter 40. Narkos IV. Diazepam i första hand. So this is first, then this, and then valproate. IVA. Vilken karbon alltså. Just det. Inblåsa T2. Felaktigt. Like this. That's wrong. Oh. Muskelinvasiv. Oh, right. Yeah, that makes sense. Endoskopisk behandling. Oh, this. mean, this... I feel like is this insulin? Is it masks it temporarily, right? Insulin increases inflow of calcium into the cells. No, this is what fuck. Calcium gluconate, yeah, it protects the heart. Fuck. Yes, well, this was the secondary, because so I was right. But you have to give this first to protect the heart, and prevent arrhythmia. This looks insanely complicated. I'd say it is. A lot of this stuff is very complicated. Well, it's just fucking, it's just so much, honestly. It's not complicated, it's just so much. There's so many areas. As you can see here, it's endocrinology, orthopedics, urology, neurology, gastrology, not gastrology like cooking, but like gastro diseases. This is GI tract. There's nephrology, anesthesiology, oncology. So it's like 1, 2, 3, 4, 5, 6, 7. Yeah, there's like so many areas. It's like the whole fucking body. I don't understand who wrote this exam. It's just too much. Behandlingsordning gallstenssjukdom, septisk kolangit. You have gallbladder stones and you have septic cholangitis. Obviously you need antibiotics. Ooh. This one. You give antibiotics first, you do ERCP within 24 hours, and then to alleviate it, and then you do cholecystectomy. ERCP, yeah, decompresses the gall ducts temporarily or acutely, and then you do cholecystectomy to prevent this from happening. And obviously you want to give antibiotics if there's a septic cholangitis. Oh, what laboratory test is the first step with hypercalcemia? Oh, to figure out what PTH? Högt PTH plus högt primär hyperparathyroidism. Yes. Lågt PTH, högt calcium, malignitet. Oh, right. Yes. Good. Alright. Inflammatory bowel disease. What's typical for ulcerous colitis? That would be like continuous inflammation starting from the rectum. Yep. This one. Never transmural, never duodenum. Colectomy is curative. Yeah. Oh. Urothelial tumor in near kidney sinus. You would have to do nephrourectomy. Nephrourectomy. This one. It's because you may actually be trying to summon alien saucer you found somewhere. Something complex isn't. What are you trying to say? It's because you may actually be trying to just like summon alien saucer you found somewhere. Oh, it's because you're actually trying to understand some alien. Oh, yeah, yeah. Yes. Exactly. Yeah, that's a good analogy. I agree with that. Like, I understand what you mean. Yeah. Either chance, nature, God, or aliens. You know, I had a... So, one of the most influential teachers I ever had was in high school. And she really, like, encouraged me to go into medicine and become a doctor. I was worried that my grades weren't gonna be good enough to get into med school, and she was like you'll make it, and if it doesn't work, you can go to Poland or like the Balkans to learn it. Not Balkans. Yeah, like you can go to Europe if you can't get into school in Sweden. And she like pushed me and encouraged me. And she was my biology teacher, and she also had chemistry, and she was a Christian, and you would say like, well, if you're into the science field, that would lend you to be an atheist. But she said like, the more you read about the human body or nature in general, how complex everything is and how like fine calibrated everything is and how things are just working so perfectly, you could as easy as you can go like, well, this is like natural selection, it's deterministic. You could also go like, well, this is intelligent design, this is God. And that's why everything's so beautiful and so perfect. But then I always said, well, how the fuck do you explain the thousands and thousands of people who die to choking every year? Because our esophagus and our trachea are this close to each other. Why would you put the thing that we use to breathe next to the thing that we use to eat, right? So if something that's supposed to go into this tube goes into this tube, you die. And then you put them next to each other. That's not intelligent, if you ask me. Hey, Thea. It's this. Oh yeah, we already answered it. Okay, L-dopa, Parkinson. Vanligaste långtidskomplikationen. This one? Like talk. Gleason, oh, Gleason. Histology. Dominant mönster adderas. Speciellt tema och förstahandsbehandling. Oh. I don't know this. Okay. It's what I actually thought. This. Det är därför backup ceftriaxone är ceftriaxone for antibiotic prophylax, PPI if there happen to be ulcers, and terlipressin is to decrease the portatrycket. Pressin sänker portavenöst tryck, ceftriaxone minskar bakteriell translokation. Yeah, yep. Good. Christiana Gravis. The fuck is that again? Oh, it's like acetylcholine. Or is it? I think it's this. Ja. Nikotinreceptorer mot en plattor. Tiger på svaghet. Just typ vid ätning. Japp. Guillain-Barré. Typisk liquorfynd. Oh. Not this. It's not this. What is this? Albumin och cytologisk dysfunktion. Inflammation i nervrötter, proteinläcket till CSF med inga... Oh, ja, just det. Immuncellerna... The immune cells are like maintained in the nerve roots. Primärt nephrotiskt. It's a nephrotic syndrome that's not inflammatory, so that's like bleeding and shit and stuff. Oh. So it's not... Well, that's the number one chance for glomerulonephritis. Primärt. I feel like it's this. Yes. Diabetes är vanlig sekundär orsak. Minimal change to cheese dominerar hos barn. Just det. Good. Nice. I västvärlden. Pankreatit. Gallsten. Has to be. Yep. Nej, snabbare. Snabb. Yep. Minimal change disease. No! Fuck, I knew that this... Oh. Bench Jones, positivt. Oh, if I'd read it. I know it's cast now for Immunome. Yep. Maybe I should read more about this. Testicle torsion. Operation mellangående. L5. I have to learn these. Fucking dermatomas. This is a ways down, I feel like. There we go. O5 is medial. Medialt underben. Oh, lateral. Fotrygg. Yep. Yep. I had no idea. Just det. I remember that. Oh. Oh. Okay. Well. Vad används i EBS för diagnostik? Okej, vad används IgA-brist för diagnostik? Anti-IgG. Ja. What's also fun is that AI takes insane amounts of energy to create an elaborate image I cannot understand or act independently. But a brain with 2k calories a day can't do that. They cannot understand or act independently with a brain with 2k. Yeah, that's actually fucking, that's, yeah, yes. Yeah. So, oh my god, that's so good. Because, like, if you would ever make an argument of, like, why is it beneficial to a society to, like, have social security, to have a safety net, to make sure that people have a roof over their head, that they can afford food, that they can afford education. Because a well-educated, like me, like a well-functioning person, like if you're thinking about a long-term investment, I can maintain higher function and productivity on 2,000 calories a day. Now you compare that to fucking, yeah, like you say, like AI centers or whatever, or maybe they did the fucking math and like it's easier to just, well, I don't think they fucking care. It's like something can be insanely inefficient and just destroy the environment and make things worse for people as long as it's profitable. That's the only metric. It's not if it's efficient. Like you can find so many inefficient systems that are profitable. So it has nothing to do with like efficiency. It's just, is it profitable or not? That's just because like there's a circle jerk between AI companies. It's a Ponzi scheme. It's just pump and dump schemes. It's all driven by markets, like private equity and market speculation. I haven't even thought about that. It's a very interesting idea. Vilket som på sig inte MS. Svaghet dominerar höger arm, stegar reflexer. That's MS. Bilateral svaghet, stegar reflexer. That's MS. Ensidig peroneus pareas, drop fot, ensidig abducer, this one. Perifera elementskada, MS drabbar CNS, övermotorneuron, stegar reflex, spasitetsprovincies, yes. Trombolys för kemisk tidsintervall, trombolys upp till 4,5 timmar. Måste göras innan utsätta blödning. Man behöver inte se infarkt på CT, men måste utsätta blödning. Yes. Första behandling vid osteoporos. Bisfosfanater. Bisfosfanat. Solidronsyra. Dexamethason. Salter Harris 4. Då har vi fraktur genom tillväxtplattan. Fraktur, metafys, tillväxtplatta, epifys. I think it's this one. Så fraktur, metafys, epifys och fys. Och typ 5 är rakt igenom. Intellektuell fraktur kräver anatomisk reposition och verifiering, risk för tillväxtstörningar tror jag. Ja. Ja just det, destruktion, den har plattats ihop. Nej, vad gjorde jag nu? Jag råkade klicka. Ja just det, vad visar fibroscan 20? Oh my god. Ja det här behöver jag läsa bättre om. Inte cirrosmast, kanske cirros. Inte cystoskopi. Ja. Vad är IPSSS? Ja just det, frågeformulär. ALS, ändå godkända sjukdomsmodifierande läkemedel. Riluzol. Eller? Nej. Den. Fan, jag sa Riluzol först. Idostigamin, vad fan är det för då? Okej, Myasthenia gravis. Myasthenia gravis. Gravis. Okej, Riluzol. Back negativ. Övergående. Avvakta. Hypokratiturit ger övergående hypotyreos som spontan domesticeras. Inte verksam. Tidigaste tecknet. Här. Ja. UP. Prostatacancer. Vilket prostata stämmer. Det är ju den här. Ja. Relativt avlastande åtgärd. Ja, bra. GBS. Okej, Guillain-Barré. Du så. Åh. Okej. All right. I feel like my brain is so overworked. I feel like I have like something that's just covering my face, my brain, and everything. I think we are gonna have dinner, and then we're gonna game or take a break. I don't know.